Hey guys, real quick, before we dive into today's episode, please remember that while our guest is a healthcare professional, the advice and opinions shared on this podcast are for entertainment and informational purposes only. We encourage you to consult with your own healthcare provider for any medical advice or decisions related to your health. Thanks so much and enjoy the show.
Ladies and gentlemen, welcome to Download the Uplift. My name is Gabriel Mark, reporting live from the home of Stone Cold Steve Austin, Texas, joined as always by my co-host, that's also one of my good bros, Dane Davis.
What up, man? How you doing?
What's up, brother? What'd you think about that intro? Does that kind of work? Host, bros?
Yeah, well, it's true. It is true.
Okay.
So, I think it works.
Well, yo, this is a historic day. Yet again, another milestone, my dude. This is episode number 15. And yo, just ask me, why is it so historic?
Well, I think most of our episodes are historic, but it looks like there's a third person once again joining us.
We got our third interview. Ladies and gentlemen, I want to introduce you to the man, the myth, the legend, an absolute boss of a dude. He is a born and bred Texan and a premier patient care technician at the only level 1 trauma center here in West Texas. I want to introduce the audience to Adam Walton.
Hey guys, how's it going?
What's up, man? Hey, thank you so much for taking a little bit on this lovely Tuesday to chat with us, man, and chat with our almost Beatle-esque level of fans here at Download the Uplift.
Thanks, dude. It's great to be here. You've been telling me about this possibility, and I was just kind of stoked. I'm pumped for it.
Yeah. No, it was awesome. We're both out here in West Texas, and I got to talking with Adam, and then we started talking about podcasts. I'm like, yo, Dane and I, we really need like a medical professional of some kind. I didn't know exactly what you did, but I always see you like in full-on scrubs, like the legit uniform, like headgear and everything. I was like, yo, this is the guy for Download the Uplift. So it's cool because, a lot of people, listen, the most precious currency is time. And so for you to do this is, it's cool. Like you could be on the couch with your lovely bride chilling. Instead, you're talking to two absolute champions.
Thanks for being here, man. It's awesome.
Of course.
And it's great. It is great having like a medical professional like to talk to and everything. Cause like I actually watch a lot of YouTubers like Dr. Mike and stuff. I don't know if you've heard of him. But like
Mikhail Bertosky. Yeah. Mm-hmm.
Yeah. And it's always interesting like hearing them speak about their experiences in the hospital or just like, in the doctor's room or whatever it is.
Yeah, here we are, boys. It's been, so we're at the end of August when you're listening to this. Dane and I have actually had 2 weeks off because, believe it or not, it actually takes a good amount of effort to run a podcast and edit it and come up with scripts and talk about. So it's almost not rusty, but I feel fresh. Dane, how you feeling? You feeling fresh?
Oh, right now I'm a bit sick, but other than that, fresh.
Isn't just part of the scripting because I'm here, is it? Like, it's just like, it's like, okay, just be sure to get sick this week. So that way he can, prescribe, like I could prescribe anything, but
yeah, it's fate. And we all know that it's good to film a podcast to diagnose ailments. That's really that's the procedure.
Maybe with Dr. Mike, but yeah. I could bring you some ice water. I don't know.
Yeah, well, I do have some water in my tiki mug, which is
let's do a tiki check.
Doing me some favors right now.
That's about it.
Okay. Well, how about this?
Well, I'm kind of double fisting here. I got coffee.
One's got rum, the other's got OJ in it.
But that water bottle looks like it holds the right amount of water for your daily consumption. So
it's about half a gallon. So on a typical day, like in the emergency center or something, I'll probably like fill it up at least one more time in the middle of the shift. So I end up probably around a gallon for a 12-hour shift.
That's important. It's a physical job, so gotta stay hydrated and everything.
Of course. I can't wait to get into that for sure. And also, I already wanted to dive in the fact that, like, because hasn't the whole video diagnostics, or whatever the right phrase for it is, like, I had something like strep throat or something last year, and it was just a video call, and the guy's like, here you go, I'll send it over to your CVS. Like, it was pretty awesome that it's that easy. I can't remember what it's called. The video, what's it called? The video, like, doctor.
There's a few things. There's like Teledoc is a popular thing for it, or telehealth, or something like that.
Yeah,
I've heard of Teledoc.
So basically, are these doctors just sitting down and call, and, like, at the end of the day, it probably is just like, hey, some of the stuff is that easy. Like, I know, let's do some antibiotics, let's do this, and I don't know.
Yeah, there's some stuff that's like definitely easier to do over video or something like that. If they can be like, oh yeah, it might be, strep, or if there's things you can tell, like, oh, it's an upper respiratory infection, and like if they know enough history about you, like, whether you're asthmatic or not, something like that, then yeah, some things can be a little easier to, and actually possible to diagnose over video and stuff. There's some stuff where it's like, oh, I just realized I flashed a 103-degree temp and I have intense abdominal pain in my right lower part of my abdomen. And then, in that case, it might be like, you need to probably go to the urgent care or the emergency room. Wow. Like, there's some stuff like you have to like see like in person in order to die, even if it's like not as acute of a thing. There's some things that are much better, seen in person. Like, there's some things for like, if it's like testing for flu, like, well, it could be flu, but until they pop a little, test out your printer or something, you can show it to them. Like, that's something that has to be tested in person. So, I mean, it's definitely keeping, it's keeping some bodies out of the urgent cares and emergency rooms where, other ones could be, or where it could free up some room and resources, while at the same time making sure that they're still taken care of. So there's lots of things that are still being worked on around that, but and it's not something that I work with a ton. Of course, I deal more with the tactile, more in person stuff, but it's definitely come a long way. I've used it a couple times, or sometimes if you need like an emergency like med refill on some kind of SSRI, or something for depression or something, like I cannot go off this med, like sometimes they can help you out a little bit with that. So it just depends.
Yeah. Golly, I already want to dive in. Hold on. We have chores to do. And let me start by saying, make sure you hit that like button and make sure you smash that subscribe button, and make sure you ring a ding ding that alert bell. Because you can get more content just like you're hearing. You can get into the minds of not only Day and ourselves, but precision experts like Adam here. So make sure you hit that like button. Yo, the channel's doing great. We're at about 130 subs on YouTube. And I just want to shout out real quick. I actually told Dane and Adam about this, but I want to literally say thank you for, here we go. Thank you for the people that have been watching on YouTube. So last month they sent us a little thing that said 19 new subscribers and a total view of all shorts and the videos of over 10,000 views. Now I get it. There's people with like big dog numbers and stuff like that. But for us, for a new channel, for, just grinding, putting out content, that means a lot. So we just wanted to say thank you. Download the Uplift family. And that was really cool to see. So thank you for that, guys.
Dude, I think it's crazy. Like, I couldn't imagine 10,000 at this stage, because it's been 3 months?
3 months, yeah.
It's crazy, man. It's awesome.
Gotta stay after, right, Adam? We after it, baby. Let's go. And he's a day one. Johnny, Ken, Adam, these are day ones. These are when we have the fleet of Ferraris, we're like, yo, Adam, here's a Ferrari, bro. I got you. But shoot, yo, it's a beautiful day here in West Texas. A beautiful day here in the good old US of A. It's also a good day if you're a DoorDash subscriber. So I don't know if you guys knew this, but DoorDash has a thing where you can subscribe monthly to avoid or reduce the delivery fees. Now, I've delivered DoorDash before, and some of the stuff that these people are getting delivered, like, it's crazy. I remember I went to Taco Bell to bring this chick like a single. Oh, I think I might have told the story, but oh well. Like a single taco. The girl probably spent like $20 for a single taco. I have told this. But either way, so DoorDash offers a subscription service, and they've just come out with the fact that if you have that, you get a free subscription to Max. So just so you everyone's listening, you now can watch Game of Thrones while you're eating your overpriced delivery Taco Bell. Your thoughts, gentlemen?
Oh, it's a good time to have HBO Max, man.
Mm-hmm.
You got Game of Thrones, you got The Boys. Season just ended for me, but we'll wait another year for it.
I thought The Boys was
is The Boys on? Yeah, that's what I thought.
Oh no, yeah, it's Prime.
Wow.
And so is the new Game of Thrones. So never mind.
Well, all right.
Yeah, never mind. Max sucks, man. Like, what the heck? It doesn't even have freaking.
Yeah.
No,
it's all right. I don't know.
My wife watches
horrible.
Friends. My wife watches Friends pretty religiously, and so Max, we get it with our internet, and so like it's pretty like it's pretty necessary, kind of next to our purchases for rice and important stuff. So
that's fantastic. That's so funny because Ken's whole thing was Friends too. Him and his wife. I've tried, man. I have literally tried to get into Friends. I don't get it. I'm a pretty open-minded cat, especially these days. But I was like, yo, all right, let me understand this. I want to be into Friends because like it's one of those office level shows. I heard like it's a feel, or like Seinfeld, like a feel good show. Is that kind of the vibe with it?
I was just gonna say it's nostalgic for me, but yeah.
Sure. Yeah, there's definitely a nostalgia factor. To be honest, I did try to get into it a while back before I met Stephanie, who's now my wife. And it was kind of harder for me to get into it on my own. And I was also kind of in a different place in life too. That might have been part of it, but there's something about whenever she has a really vested interest in it, and I'm like, oh, okay, I'll watch it some. And now I'm, I still don't think I love it as much as she does, but I know it's actually enjoyable for me, like much more than it like was beforehand. There's something about, she enjoys that too. So, I mean, I'm game for it. Anytime there's like a Friends trivia thing at some kind of bar or something around here, we try to go to it.
Dude, let me know. That sounds awesome.
Yeah.
Well, I don't know if I would do well, but any trivia night in general seems like a good time. A couple drinks, answer some fun questions. Oh, you know what else is on Max? And this is, for some reason, a bunch of my boys don't like this show. Yo, that show stinks. Is Big Bang Theory. I like Big Bang Theory because they don't like Sheldon. All right. So it's like it's a feel good show. Like, well, it's got fake laughs. It's like, what's wrong with that? It's just like the whole psychology of smiling. Like if you smile and you're stressed out and you smile, you feel better. Like, I don't care what anybody says. I did it the other day. I was stressing. I was like, okay, I feel better now.
Is that a smile or a grimace? Yes.
It is the Joker.
Yeah, I'm not a fan of the Big Bang Theory.
Oh, yeah. See, I knew you were one of them.
I don't know. It's just it's like Futurama actually like has a lot of like scientific stuff in it and math related stuff, but like Big Bang kind of like phones at home a lot of the times with their science. So I just kind of go like, but yeah.
How technical do you want them to get?
Well, Futurama, you can watch it without it being technical to you, but there's like hidden jokes everywhere where like if you know what they're talking about, you're like, yeah, I appreciate it.
Yeah, I can kind of see that where they kind of make more of the humor and content and stuff accessible to in Big Bang Theory. Like it, I mean, and that's one of the reasons it's really successful. But I kind of get what you mean there. So I mean, it's fine if you don't like it. Not everybody's perfect, Don't worry about it. But no, it's definitely an acquired taste.
I didn't even know. I thought it was for like younger kids. I didn't know it was for in their 20s and 30s. Yeah, I'm a millennial, right? If I'm 39, is that what I am?
Yeah, I think you're.
I think so.
Yeah.
I'm I think just on the cusp of a millennial. So
wait, are you Gen? What does that mean? You're Gen Z?
No, I'm just on the cusp of it. I just made it into a millennial. I
think you and Adam are similar in age. Adam, if you don't mind, you don't actually have to tell us. I mean, you can lie if you want to. How old are you? You could totally lie.
No, I'm 32.
Oh, see? Actually,
yeah, we're the same age.
Not me, boys. Let me tell you a little something on this podcast. It gets rough out there.
We just made it. We just made it to millennial.
Did you guys know that today, which was 2 weeks ago when you're listening to this, Twisters is going to be available at home, the sequel to the original movie Twister. Did you guys hear about that? The dude from Top Gun's in it. What are your thoughts? Twisters.
It's already available at home. Like,
yeah,
it's supposed to be in theaters.
It said, "Is yours to own or rent today." This is 8 hours ago. Well, dude, because no one goes to the movies anymore. So
I went. Hey, I went and saw Deadpool and Wolverine.
Look at this picture.
Oh, how was that? Did you like it?
Oh, I loved it. It was my favorite Marvel movie since the last Guardians of the Galaxy.
Wow.
Yeah, it's like just a raunchy, like, right? They go because listen, the first one I liked, but I haven't been keeping up with the Deadpools.
I mean, they pay homage to like literally every character. Well, not every character, but a lot of characters that were around during like the Fox era of like X-Men and stuff like that. So not to spoil anything, but yeah, there's some like cameos and stuff like that, that's just Deadpool at this stage. But yeah, no, I thought it was great. They did it very well with Wolverine, and you know, it's just like they respect the characters are well written and all that stuff. So
what about Twisters or Twister? Did you know what's crazy? This is definitely going to show my 7 years on you boys. Is that I remember going to a drive-in in Massachusetts and seeing the original Twister. And then in the movie Twister, a tornado goes through the drive-in. It was real. Things got real, y'all.
It was meta. It was meta.
What's that?
Meta is, it's like when it's like the I'm gonna screw this up because I'm on the spot here.
Welcome to the jungle, Adam. This is how it is. Sometimes some of us are prepared with DoorDash fun notes and movies, and others just throw out random facts. And you know, I don't know how it works like that, but
heck it, we'll do it live. It's cool.
We'll do it live.
We'll do it.
Oh, okay, yeah. All right. So it's a creative work referring to itself or to the conventions of its genre. So it's just it's meta because the tornado is going through a drive-in and you were at a drive-in watching a tornado go through a drive-in.
Well, I thought it had something to do with simulation because I was actually speaking with Adam the other day and I said, I put it in my Hinge profile that I'm pretty sure that I am in a simulation because I've never seen any of my neighbors bring in groceries. Like, I know that's like kind of a running joke, but like, especially my one neighbor, this girl, I've never seen her. But the thing is, no food at all going in, like not even like a delivery man. Like, so I get it. Elon and whoever's watching me in my simulation, hopefully you guys are getting a good show.
Well, they all enter the door, and then as soon as the door shuts, they just go.
Yeah. It's possible.
Oh, you're buffering for a bit. I was like, wait a minute, what's going on?
It's pretty good, right?
It looked good. Adam showed up to be on this show, and literally a week before, I was like, it'd be really cool if we could have a healthcare professional on here, and then all of a sudden, so that's like the simulation people. Like, here you are.
Yeah. And that's why I'm sick.
Exactly.
It all adds up, man.
I know what you guys are doing. You're all programmed to.
And I'm fake, so you know.
You know, what'd be really great is if we could all make serious bank somehow from this episode. I mean, not make it or break it, but that'd be great. Whoever listening.
If this podcast got 1 million views, that would be pretty cool, eh?
If we were sponsored by Frankie's Tiki.
That simulation thing is wild. I know we talked about that, but just when Homeboy's in the Matrix cutting up the steak, Ralph Cifaretto, he's like, the Matrix is telling me that this steak, but I know it's flavorless. That thing looks so good. I was like, it's impossible. That was a good looking steak. Like, I don't know if you guys remember that scene, but
I'd eat there.
Yeah, 100%. Did anything you need to bring up before we get into some business at hand here, Dane? Anything going on?
I'm sick, man. I didn't get the chance. I'm sorry. No. That's what's currently happening in the world. I'm sick.
Well, make sure you drink your fluids, get your rest, because I happen to know of a healthcare professional that can talk to you as well. But I'm pretty sure those two things are like on every, whether you're any kind of level in medical care, it's like get rest and drink fluids. I mean, would you say those are pretty good staples, Adam?
I mean, yeah, I mean that's pretty basic whether you're sick or not, man. I mean, you guys stay. I mean, no, seriously, you gotta stay hydrated. But I mean, you gotta be especially sure. You just gotta make sure that you have your, whatever kind of fuel you need to kind of, rebuild yourself, basically. Especially with something like that when there's a lot of things, upper respiratory wise that are. I'm not saying what yours is, okay? And by the way, in case no one said it yet, like anything that I say should not be constituted as medical advice. Check with a doctor. Listen to me, but don't listen to me is what I'm saying, okay?
Love that.
So, but yeah, a lot of the upper respiratory stuff when it tends to be like viral and such, like that's kind of the best thing you can do because there's not like, oh, we'll give you an antiviral. Like that's just not really a thing that you do for upper respiratory infections. So, like basically, you just want to make sure that you. Yeah, just like, well, my body's going to try to fight it. So I can give it all the tools it can possibly have. And if you're dehydrated, you're crippling your system. If you're not eating, like enough of, your macros and stuff for your body to fight it, you're crippling your system. It's just, you just got to make sure your body has the fuel it needs.
And that's something that's pretty interesting to me because we do have a lot of like treatments and stuff like that. And correct me if I'm wrong here, but, everything to do with like the common cold or like the flu or whatever, it's basically all just supportive treatments, right? And supportive care, like reducing fevers, make sure you're hydrated and stuff like that. There's not really anything that just knocks it out completely. It's your body that does it basically, from what I know.
By and large, yes. I mean, there are antiviral medications that you'll find, or some other stuff, or even if something gets so if flu or even COVID or stuff gets so or whatever gets so bad that like someone has to be like like in an ICU and like even if they have to be put on a ventilator or something like that in extreme cases. I mean, it's really just that's not the treatment itself. That's really just kind of buying time until you can help the body kick it. By and large, wow. I mean, everyone's still trying to do, antiviral medications. Everyone's trying to experiment doing something, and we'll be ever so grateful if someone can find a way out to knock some of this stuff out for sure. But I mean, that's a big thing is just trying to do damage control in the meantime while you're kind of getting over it, and then taking care of whatever damage is left after.
Yeah, but viruses are a crazy thing. They're like this thing in between living and non-living organisms.
I was watching something. It was Prison Break. That show has been is it bane of my existence? Whatever it's been, because they just released all the seasons on Netflix. Yo, it was like 4 a.m., dude. And I was like, dude, I need to go to bed, but one more episode. And one of the seasons, he's in a prison in like Panama, and they don't have water. I was like, how much water does the human body actually need to survive? And I think it was only like just to survive. Was it 20 ounces? Adam, do you know that offhand by any chance? Like minimum amount of water?
Oh gosh. So, I mean, it depends on so many different things. You probably heard at least at some point, especially if, you're an old timer like Gabriel, that, someone said, oh, it's 8 glasses a day, 64 ounces or whatever. It really depends. If you're doing very little to nothing and you're in a temperate environment and it's not super dry or anything like that, you might not need as much water. But even in that case, like everyone could be totally different. Even like body mass determines like how much water you're going to need and that sort of thing. Because like, if you have a lot more stuff to keep running, you're probably going to need a little more fluids,
Yeah.
And then that's not even going into like different conditions that people can have, whether, it's like, oh, they need to be careful with how they put their water in them, or if they need to get water out of their system even more, so I mean, it's someone that's working out could be needing like, or doing heavy workloads of stuff can be, doing maybe like a gallon or even a little more of water. Whereas, someone that's, they're pretty docile all day and they're, not really doing a whole lot, or kind of like what a day off is for me. You might not need near as much. I'm not going to be able to speak to whether it's 20 ounces or what have you. I mean, it sounds like you at least would need that, just kind of offhand. But
yeah, I don't think
it varies so much per person. Basically, like unless something in your thirst function is kind of like broke, which for some people like it can be for like, all sorts of different things. But if it's not, like, generally, if you're thirsty, drink something. It's not, your body is typically able to tell you that either way. So
that's so funny. The first thing that came up was 8 cups. like you said, OG Gabriel. It's like literally, well, that's probably from your studying. Like it literally said 8 cups, but that must be, I must have been way off with the whole 20 ounces thing. I mean, they're saying a minimum of like 3.
Well, you said to survive.
Oh yeah.
And,
so
and it's really like to be healthy, you need way more than that. Probably.
Yeah.
Well,
if you're even just somewhat dehydrated, you can have like brain fog. Your brain's not going to operate at like, optimal capacity sort of thing. Like there's all sorts of things where it's like, yeah, you'll live. You're just not going to be very optimal or, in some cases useful. I mean, it's just,
well, it also not having enough fluids and being dehydrated, it unevenly distributes like electrolytes. What I've heard is you could have an abundance of electrolytes in one place in your body, but not enough in another place because you don't have fluid circulating that enough. So any function with electrolytes, which is muscle function and even brain function, if I'm not mistaken.
Yep, you're right on the money with that one. Also, overhydrating will mess with your electrolytes as well. So, that I don't know if y'all heard, like forever ago, there was like a story of a woman that competed in a thing. I can't remember, I cannot remember where it was, but it's a radio station. They had a contest whenever the Nintendo Wii was a new thing. Okay. Like we're talking about, like, some people listening to this might not have even been alive whenever this came out. Okay. But it was the hold your Wii for a Wii. And so like the more water you could drink, without having to go to the bathroom, whoever can hold the most will win in a Nintendo Wii. And they had to sign a release waiver and stuff, which was like really saving that, radio station's bacon, because this one woman drank like, what was it? Like so many gallons of water.
Wow.
Yeah.
Like, I mean, that much water was so toxic to her body. You don't think of that being toxic. It's really about dosages, not the thing. Right. But she had so much water, basically eventually just kind of shut down different parts of the body until all of it was shut down.
Yeah. That was the first story I heard of that, but there have been more. There have been people who will like chug a gallon or 2 gallons of water like in 5 minutes, and it does the same thing. Like some people have survived from that, but you can get just water retention like on your brain, like all kinds of stuff, and then it ruins the osmosis of your cells, like to draw in nutrients and stuff like that, and keep the salt content in your blood and your cells balanced how it should be. So yeah, it's a very dangerous thing to do.
Dang, so she like internally drowned basically, right? Well, you know what? Let's just get right into it, because this is just way too awesome of a situation. Let's get into more with Adam Walton. And in order to do that, we're going to bring it with the quote of the week. Yeah, that's right, baby. Quote of the week: Adam Walton, Gabriel Mark, Dane Davis. Download the uplift. Adam, if you don't mind, would you like to check out our quote of the week?
Oh man, y'all made an assumption that I could read, huh? Okay, I'll give it my best shot. So, nah. Okay, quote of the week: the best way to find yourself. Hold on, let's get kind of close and serious. The best way to find yourself is to lose yourself in the service of others, by Mahatma Gandhi.
I like that ASMR kind of.
Yeah, dang. Ooh, I got tingles. I thought that worked very well with the help of ChatGPT for someone that's in healthcare. It says the best way to find yourself is to lose yourself in the service of others. Mahatma Gandhi, who I guess was a OG in India that was all about peace and revolution and all this stuff. But I mean, I think that's true, especially for what you do, Adam. I think that's, it's probably stressful. It's probably an insane amount of studying. The hours. I mean, I brought up the fact that I see you at crazy hours once in a while, and you're in full scrubs, full work zone. But I bet the fact that you're literally helping people and serving others, it's probably got to feel pretty good. Am I right when I say that?
Absolutely. Yeah. There's I mean, there's also, I mean, yeah, there's definitely a lot of wisdom in that quote for sure. It's a good one. There's a whole lot that you can unpack from that. But I mean, one of the things that I kind of think of off the top of my head is it's just, it kind of helps with, perspective, a whole lot. So anything as simple as like, oh, what constitutes as an emergency and what doesn't, whether medical or otherwise, but also, really what it's just, what's going on in your life and how bad are you feeling about it. And then you see people that come in, whether in the emergency center, because I work in all parts of the hospital, but for the most parts in the emergency center. Okay. People that come in and they're at their most vulnerable point, or one of the most vulnerable points of their life. And sometimes it's like, okay, well, we'll get a solution to this and everything's going to be better. Or sometimes it's not. You get to see a lot of it. I've seen life. I've seen, joyous laughter. I've seen good news and people celebrating. And I've seen people gather around loved ones that have passed. And it really kind of helps to put, in a memento mori sort of way. It really helps to put stuff in perspective for sure. And just think like, okay, well, and there is a little bit, not to diminish anything that anyone's going through by any means, but the fact that you're kind of like, well, that's, at a very high level, like, I thought my day was cruddy. Not so bad, So
Yeah.
I mean, it's a lot, and to be able to channel compassion to those people as well, it really kind of puts your it's kind of like what you're talking about a while ago, like when even if you're not feeling like smiling, but you smile, it actually has an effect on you. Even if you're not feeling like, oh, I don't want to help the world, I'm just feeling pretty selfish right now, but you help in that regard, even if it's like a channel that you're able to kind of put yourself into. And it's like there's an aspect where it's a job, and there's an aspect where like this is life to my body.
Wow.
Oh, that's awesome, man. That's really cool.
That's unbelievable. I actually did. Let me break down real quick, like I do for all of our guests, real quick, who Adam is before we get more into this. Joining us, he is born and raised here in the Lone Star State of Texas, Texan, which, believe it or not really rare these days, but there's a lot of cats moving here, like this dude right here from Las Vegas. He is a proud husband. And Dane, this is our third guest. I got to step my game up, just start swiping, but dang, everyone's married. So we got to step our games up. Flow show. He is a low key, he dabbles in crypto, which we were getting, if there's time we could get into. He's been a contract musician, an insurance adjuster, an all around good dude. And let's not forget, he also is a dog father, and not Snoop D-O-double-G, just a dog father like we are. Why, he was the dog father, right? The dog father. Wasn't he Snoop Dogg?
Well, I just thought you were saying he was Snoop Dogg's dad. I was like, man.
Oh,
well,
maybe. Dude, that dude's like 60.
Adopted, obviously, but yeah, it's cool.
Yeah. Sipping on gin and juice.
Adopted and like don't be a menace to society. You're younger than him.
It's all right. But that's who's talking to us today, man. And yeah, bro, I'm super stoked. So for those of us, I wanted to bring this up. So those of us who don't know, if you wanted to kind of explain to us, like we're in, I don't know, 5th grade, what exactly is a patient care technician? Like what kind of tasks do you have and what's going on with that?
So basically I am considered to be an assistant more or less to other healthcare providers that I'm working around, basically kind of helping with nursing things that kind of some of the more like physical aspects or what might otherwise be considered menial aspects relative to what like only a nurse can be capable of in that regard. So by menial, I don't mean unimportant by any means. But basically like anything from like, hey, making sure the patient has water so they're hydrated, or, there's also things like ADLs, activities of daily living, where we can help with anything from showering them, helping them toilet, even sometimes brushing their teeth, doing oral care, or I've even given a few patients like a good, shave, like for a goatee or something. I mean, it just, it just depends on what they need help with, how capable they are. Sometimes that they're, what we call walkie-talkie or self-ambulating, where they can do pretty much everything on their own and they're pretty good. And then it goes all the way to the extreme of some people, whether it's because they're intubated or because they're quadriplegic, whatever, they are a total care. And we have to do all the turning. And basically, like, just because they are in that kind of place doesn't mean they don't keep doing the things that everyone else does as far as like what their body needs to do, what it needs to, put out, that sort of thing. And so like we help with all aspects of care with that. And we can also help in some emergency situations. We can be runners to get supplies. We, anything from, code strokes, where we're helping the patient to the CT with a nurse, or, code blue, which is when someone goes into cardiac or respiratory arrest. And, there's a lot of times where if I'm around when a cardiac arrest happens and, they don't already have, what's called a Lucas, and which automatically do compressions. They'll have me be one of the ones giving compressions, or, working with the airway if respiratory therapist isn't already there. So it can be very wide ranging what we have to do. That's why there's so much to it. So, but it's basically being a gap filler within the scope that we have to be able to be additional hands, feet, fingers, if you will, for nurses, for other providers.
I like that. Can we see can we see how AI nailed this? Because I asked before we started this. Vital sign monitoring, right? Is that that's part of it?
Yes.
Assisting with medical procedures, supporting nurses and doctors during medical procedures, such as drawing blood. Oh my gosh, do you do that?
As a patient care tech, I actually can do direct stick blood draws. So like with a butterfly needle or hypodermic needle.
Wow.
I don't, for different reasons, it's only like licensed nursing personnel, so nurses that can do like blood cultures or like drawing blood from an IV, for example. But as far as like, I can do direct stick blood draws, and I do them occasionally. So there's some other stuff. Yeah. With the assisting with procedures, I actually can assist with sterile field things bedside. So whether it's just like, it's just a sterile dressing change and they need me to add something to the sterile field to make sure everything stays sterile and doesn't get contaminated.
Yep.
All the way to, if someone's, if I need to don something that were, sterile, to hand somebody something from like a central line kit, for example, or something like that. If someone needs like almost like a literal like lifeline to push like meds through and stuff, like it's,
wow,
it can be, there's that they put that pretty well as far as AI, right? You put that through AI. So yeah, we can help with some like bedside procedure type of stuff too, dressing changes. There's definitely a lot more. Even in the scope of this episode, we're not going to be able to touch on every single thing that every single tag or anything has or can do, but it's, there are a lot of different things that we get to help with.
Well, there's a ton on this list. I mean, even emotional support, like, you got people freaking out. They probably need you to be like, the hospital in general, especially if you're in the ER, not only just for the patients, but their loved ones too. But it could be a scary place just because of like fear of the unknown, right? It's like this bright, cold place. There's all these noises and unfamiliar people, and the anxiety levels like up there, I'm sure. So I'm sure you've probably had to calm some people down.
Definitely. Yeah. I mean, a lot of people have had to do that at some point. If you work anywhere in that kind of environment, sometimes it's the patient, whether they're scared about like a surgery that's coming up, but it's not like emergent or whatever. Or sometimes they're coming in, like a whole seat collar and everything else. And they just came in from a motorcycle wreck and they're about to be, what we call blue strip to the OR, and they have to be taken basically straight away for life, saving intervention. And sometimes, and if they're awake for that sort of thing, or, gunshot wounds, what have you, they will, and they can be freaking out. And so sometimes when all this different stuff's going on and they're like, what's going on? I'm just trying to answer my questions, stay as calm as possible. or they're scared they're like, oh, I heard fentanyl kills people. I don't think I should take it. And that's when I can, while I'm doing vitals or, checking a tympanic temp, like any little thing around them, I can kind of lean and be like, hey, like, it's okay. We got you. Try to explain what's going on. And also family members, they're like, oh my gosh, like this is happening. Anything from, oh, they're going to CT. Like what, some people don't know what what CAT scan is. And they're like, hey, what's going to happen? Are they going to be okay? Is this a safe thing? I'm like, and I get to kind of tell them like, hey, this is okay. This is a routine thing for us, or sometimes it can be, we're in the middle of trying to resuscitate that patient. And they are in cardiac arrest and you have to kind of bring them out. I remember in particular someone, and I won't be able to get too specific with some patient stories, of course. But I do remember a particular case where on a floor unit, like a med-surg unit, there was someone that started exhibiting symptoms of a stroke. So we had to initiate a code stroke for that patient. It means we could do a few things. We get a set of vitals. We do, glucometer, a glucose check. We'll do an EKG, and we'll get them a CT scan as quickly as possible to see if there is a clot. And we'll have our neurology team look at it and, determine if any intervention is needed as far as getting a clot buster or what have you. And I remember there was this woman, and she was actually the one that alerted us to the change of the patient status. And so I had to bring her outside the room for a second after I'd done an EKG. And she's like, I don't know what's going to happen. I was like, hey, this is something that, granted, we're a lot more used to than you are. This is never, even in being used to it, this is never a good thing to have to do, but you're in the best kind of place that you can be in for someone to be able to handle this. Is like,
that's huge.
She's in the best of hands. I was like, you did a great thing. You saw it immediately and you let us know that you did your part and you did great. We've got it from here. This is what's going to happen. She's going to go for a CT scan. If it's necessary to do this, then, to do a clot buster or some other kind of intervention, we can, and we can do that really quickly if needed. Otherwise, we'll just do these tests and we'll see what happens. And I'll keep you updated. There's a lot of times there's sometimes when I'm kind of in the fray and kind of doing some of the testing and stuff with other people or helping nurses and docs do that. And then there's times when, I'm doing some kind of crowd control and keep the family on, just being like, hey, look, it's going to be okay. Or just, sometimes you can't console. And so in the case where you can't console somebody and they're just, in some kind of state where it's like they cannot be calm, you just have to do what you can to kind of make room so the patient can be taken care of.
Yeah. Make sure that they're not getting in the way of their families, well-being and stuff like that. And
which they never intend to do, of course. Don't hear I'm not saying, but just be like, whether intentionally or unintentionally, just making sure that pathway for that person's intervention, life-saving or otherwise, make sure that pathway is clear.
That's it's such an important job to have. And I'll just say, for I've been to St. Rose a few times as a hospital in Vegas, and they're great with treatments and stuff like that. I've gone in for a few things, and there was one time where they immediately just saw a bit of a red flag in one of the monitoring things that they were doing, and just quick to act and very, very calming as well. And that's something that you have to be the right kind of person to do. You almost have to put them before yourself, be in their shoes at that time. So,
it's a quick question that I actually have for you, Dane, on that. Whenever you saw they had the nurses and the medical professionals working with you, and you saw they had a calming demeanor, did that worry you, or did that have a calming effect on you?
I'm laughing about it now, but at the time, I wasn't even in a clear frame of mind. I was foggy and stuff like that. To answer your question, it's definitely, in the state I was in, I was a lot calmer than if they were freaking out or yelling or whatever. But but sometimes you have like you're saying, like code blues or whatever, you have that rush, like everything needs to happen immediately. And, you know, like there's not too much time to calm people down. But yeah.
Sure. Yeah. I asked that because I think it's really important. I think that's even like a misconception some people might have, is that it's like, well, and I've had some family members say like, y'all don't seem super urgent about this, like y'all don't really seem like you know that this should be a big deal. I'm like, and that's when, like I try to see where those people are at first off, and what they're seeing. I'm like, hey, look, if there were people they seem like they're kind of casually walking around or something and didn't have a sense of urgency at all, like, yeah, that'd be worrying to me. Also, you got to think, in a crazy situation, when you have someone that knows what to do in that kind of situation, do you want them to be frazzled or do you want them to keep a clear head? Personally, would want them to have a clear head, but it's just, it's all perception about how it's like, are they taking care of me? Like, really? Like, you don't seem too worried about this. I'm like, sorry, this is just really routine for us. It means a lot and it's important. We want to get it right, but
well, and it can seem like routine as well, but I think like what you're also saying is like sticking with the procedures and stuff like that to make sure that what you're doing for the patient isn't going to harm them further, and being sure that like the diagnosis is correct, and then like there's a handful of things that can happen, like someone having a seizure, someone presenting with like some kind of cardiac arrhythmia or no heartbeat, no breathing, and that's when the rush happens, because it's immediately like chest compressions, get the airways going. That stuff I see people reacting like immediately, but beyond like those visceral, like you need to correct this now to save the patient, like taking a bit of time to evaluate it's necessary to treat them the way that they deserve to be treated and should be. Yeah, that's kind of my take on it.
Listen, I've been in the hospital before, and having that, like, it's almost like your buddies there, not the scary doctor to like judge you. You have like Adam, big, hey man, it's gonna be all right. Like, and like you mentioned the CT machine, is that the one, like the 100 or however much money those things are, the one that you go in, is that spins around? Like, is that the CT machine?
Yeah, it basically like kind of takes lots of, it's like what an X-ray is, but like multiplied by a lot. So like it kind of like gives like a 360 view and can kind of build like on the inside and all kind of bounce around each other and with bones and with other things. And they can use things like contrast in either your gut or your blood, which will react with the X-rays, and so you can see certain things like, oh, if there's a clot there or something. But
wow,
but yeah, so CT is like the kind of the imaging all around, and that's what we would use to see like, oh, is there like a bleed or a blood clot, or like even certain trauma and such. Like, instead of, if someone's been through like a whole body trauma and they're not a responsive patient and they can't really tell you what the story is, then you might have to do a bit of a pan scan, which basically means just scan everything and see like, is there damage in like certain places, like in anywhere, because you have to see if there's any trauma whatsoever, because when you run a trauma, you have to make sure you don't miss something like that. So sometimes they can't tell you the story. You got to look everywhere on the inside. And
you said that's so level 1. I remember. So I was actually, I don't know if you heard about the shooting in Las Vegas in 2017. We call it 1 October out there, but that was, I think 58 people lost their lives, but it was all of the local hospitals were packed that night. The one there is UMC, and that's a trauma one, and that's like a big deal, right? To be categorized as a trauma 1 or level 1 trauma center, like what basically you can handle the worst of the worst situations. Is that basically what that breaks down to?
Basically, yeah. There's 5 levels of trauma centers, at least in Texas that I'm aware of, and I think most parts of the United States. There are some other classifications besides, but as far as trauma centers go, there's 5 different categorizations. Level 1 being the highest. When they talk about like the kind of level of trauma care that can be expected at that facility, level 1 is the word used to describe it is comprehensive. So I mean that's it's comprehensive. It's like, for what? Yes,
Wow.
I mean, as far as like things now there are certain things that like other facilities might be better suited for, like UMC. They can be a level 1 trauma center, but they may not be the designated stroke center. That doesn't mean we can't take care of stroke patients. It just means that if a paramedic is like, hey, like they may opt to initially take them to the stroke center. So they might get like a stroke right off the bat, but if someone gets multiple gunshot wounds, that's going to come to us.
I can't even imagine.
So it's kind of, like I said, we get to see a little bit of everything there, and it's again, don't hear what I'm not saying. It's not a gift to see people suffering, okay, but it is a gift to be able to be in a place where the suffering people go, and you can learn how to help turn things around for them or to mitigate damage. Basically the science of caring for these people, and in so many different ways. You just see a little bit of everything, get experience with lots of different kinds of, like urgencies, emergencies, that sort of thing, psych issues. Oh gosh, psych issues, or, people that even get, as we sometimes say, a little methed up, because meth seems to be the really popular thing around here. So, I mean, you see everyone on everything, but there's a lot of, meth that's sold around here, unfortunately, relative to other drugs.
Are there, because opioids are just a huge thing in certain states, and do you have a bit of an opioid crisis there as well, or is it just like kind of mainly methamphetamines?
Yeah, what is the main like thing that you see people dealing with, like drug or alcohol? What's the main thing you see?
Let's see. I mean, eventually I see like a little bit of everything. There's, but I would have to say that a lot of the different things that we deal with, I mean, there are some people that are on, whatever kind of illicit drugs, but probably more than any of those, we deal with people that are alcoholic. There's some people that are like, okay, well, yeah, you'll mess up your liver if you drink, 3 beers a day for your whole life, or what would be left of it after the fact, but then there's extremes where, I kid you not, people have been used to drinking anywhere from 25 to 30 beers per day, or like shots of beer. No, cans, 12 ounces of beer, 25 to 30 of them, or people that will drink 3/4 of a gallon of vodka per day. And at that point, because that's withdrawals from alcohol is like, if I'm not mistaken, it's one of the few types of withdrawals that you can actually die from directly. It gets to a point when you drink so much that you have to drink a certain amount so you don't have seizures, basically. Like the withdrawal process in your body is so bad. And I mean, not like seizures like, oh, your body just stops for a second or has to reboot. No, like seizures cause actual like brain damage and stuff, besides any kind of secondary damage from falling with one or what have you. It's really I've seen anyone I've seen people like 70, 80-year-olds that they're in liver failure. I've seen 30-something-year-old patients and they're jaundiced and they are in liver failure, and they've gotten palliative consults like, hey, we're going to try to help you plan how the last 6 months to a year of your life's going to go. Like that's pretty heavy stuff. And I'd say that it's a lot more rampant than like a lot of things. And it's like, oh, but it's legal
and it's socially acceptable everywhere. Like, but when you say jaundice, have you actually seen because I've seen like photos and videos of like in Russia or something where their eyes are literally like canary yellow. Like, that's jaundice, right? And like literally, and basically is your liver just saying, hey dude, I can't filter anymore. Is that basically like,
yeah, when you have like liver disease and stuff like that, it like most of the diseases and stuff that materialize from like a coroner's perspective, it's like dead tissue on organs and blockages of blood. So liver failure is like your liver has so much dead tissue on it, it's not able to filter. Like it's it just doesn't have the capacity that it had before to do that.
Yeah, and couldn't have said it better myself. That's great. Liver failure is not great. Again, you know what I'm saying.
Yeah.
But
Not good. You need that thing.
No. But I have seen people that are and you can be like kind of like there's ranging, levels of like, being jaundiced. Like someone could be jaundiced a little bit. And it's like, okay, there's a little tint of yellow to their skin. And then there's times when it's like, yeah, even, their eyeballs, everything is very yellow. I've seen the whole gamut with that.
I like, I like drinking and stuff like that, but it's rough when you have an issue with it, because it's not only legal, it's not only accepted, but it's celebrated as well. And like for the average person, it should be it's a great way of letting loose and dealing with the stresses of the day. But then you have the other side where people are just completely dependent on it, and it's really hard because it's like most of your friends probably drink.
Yeah.
Friends are probably like, hey, come out to the bar, and you're like, well, it's just it's probably worse than smoking as far as like the amount of times that you get asked like, hey, do you want to drink, or like you want to come out and be around alcohol.
Mm-hmm.
That is the social aspect's really tough part of it, or even some people's way of medicating, and they can't or don't want to be or otherwise separated from social situations. It's there's a whole lot. There's a whole lot to that.
Yeah. See, I'm so glad you brought that up, because I was talking to Dane about this, bro, because I've had serious problems with booze to the point where I've back in 2019, I had to go to the hospital because I thought I was going to die. I was coming down from like a 2-week bender, and dude, the benders back in 2018, 2019, they were like from the moment I woke up from my pass out, drinking Trulies all day, acting like chaos, but it would go on for like 2 weeks. And when you come down from that, dude, like the audience, if you've been through withdrawals, it's like you're in a internal hell. It's like you're anxious, you can't rest. Restless is an understatement. I had like the tremens a little bit where I was shaking. I mean, listen, I've seen episodes of Intervention where they're literally like drinking a gallon of vodka, or like they can't. I don't know if I was at the level, but I was at the point where I should probably go to the hospital, but they gave me like benzos and an IV. But when it comes to addiction in general, I was talking to Dane about this, and this is once again, like Adam prefaces by saying, we're not giving any advice on this show, especially me. I'm just some dude on the internet. But for me, I've been to AA, I've been to Celebrate Recovery, which is like Christian AA. But both times I would come off of it and it just turned into a mess. This is very controversial opinion, but I think that until you are at peace with yourself and you're at peace with what's going on upstairs, I'm getting all emo about this, you're going to be a mess. You're going to want to escape, because that's what I was doing. Like, I just came off of a great vacation. Guess what? Then it's back to normal life. Like, this is soda water. It's not like, whereas the old me, something was going on, and maybe I wasn't doing enough journaling, but I'm finally at a state of peace with myself where I don't want to listen. I love having some cold beers. It was fun, but then it's over. And I think that if you're chaotic up here, then you're going to go down the slippery slope of addiction. So that's just possibly unpopular. Some people say it's AA. You better be counting your days. You better be going to meetings. And if that works for you, then that works for you, and God bless it, and do whatever works for you. But I need to stress the fact that you need to get right with yourself. And that's that.
No, dude. I'm so glad that you're at that point in your life where you're just wanting to do more than that, and
just drink all day.
Yeah, and I think everyone's been there in various ways. I have. I was never like at the point of needing like a serious intervention kind of thing. But there's what you said about being okay in your own mind, being okay with yourself. I think it's so important. And I think people, they do miss that, because you have like the 12-step programs and everything. And I think those are great. And even when you want to talk about like other medications that can help you out, psychologically, physiologically with your brain chemistry, I think those are great. But you can't underplay the importance of the legwork of figuring out what's going on in your head and trying to master that and make it a more healthy thing. And I've been doing that like crazy over the past couple months as well, and trying to do it for years. But yeah, when you're fogged up, when you're just chaotic, like you said, I think of so many things all at once, and I just end up being in this huge like brain fog, like not really knowing what I'm doing and what I'm like thinking, and just you just end up spiraling out of control. And it's so important to try and like pull those reins in, and yes, use the programs, use the medications to help you with that. But at the end of the day, you have to do it yourself.
Have you ever like seen someone kind of going through some real addiction and been like, hey man, what's going on, bro? How can we fix this? You know what I mean? I don't know you. Like, have you ever said this to a patient? Like, hey, I don't know you, but what's going on? How do we make this better? How do we stop this, not to use the word again, but this chaos? How do we stop this hurt you're doing to yourself? Or do you kind of just cut that out? Like, do you like, hey, this is the patient, that's it?
So it's definitely situational. You gotta realize is that places like places we have, when you get admitted for certain things, whether it's withdrawal or like other what are considered social reasons, like if you're wanting to go into rehab, whether it's due to that or because someone's feeling suicidal, whatever you need rehab for, the people that we have a lot of resources that we're able to share with them. And again, like Dana was saying, the resources are not the end all be all, by any means. You need to decide that that's what you want to do. There are times for sure, though, within that context that I have reached out. I think of a couple of type of situations where there were some people that were just really down. They went through some intense situations, and they were feeling really down as a result. And so then they went back into their addiction, or they became, suicidal, and that's why they were there, or someone brought them there, or what have you. And like I said, while there are, in all these cases, we try to give them, the best of the resources that we can have, whether they're able to, pay for stuff or not. We want to make sure that they're, they get what they need. There are definitely situations I, reach out, I'm like, or even if it's not what they're there for, they could be there for, gallstones, something else. And it'd be like, because I feel like I'm a caretaker, not just of their physical being, honestly. But that I also like to try to think of myself as a caretaker for the soul. If your body's about to go kaput, the priority lies with keeping that here, right? It's like it's the vehicle that you're in is very important. But once your vehicle's okay and not catching on fire, or broken down or what have you, not being taken to the junk heap, whatever parallels you want to use for that, you gotta look to the driver too, because if the driver's not want to drive it, anywhere, it's like what's the point of having the car? And that's some of the crises that some of these people get into. But also just there have been people I'm like, hey, look, you seem like you're very upset, or even in some cases, like you've seemed like really hostile towards a lot of people that have been taking care of you. All sorts of different situations. I'm like, what's going on? There's even been a few patients that I try to stay open in these kind of situations, but I'm very grateful that There's a couple that I've even had a chance to comfort, family members and patients that I've laughed with, cried with, just being empathetic to them in that moment. And like, even if you in situations got to pray for them and with them, it's really, that's not in my job description by any means, but that's my desire as far as like being able to take care of, the soul as well as trying to help take care of their body.
Mm-hmm. Amen.
Yeah, I think that's so important, and you seem like definitely the right kind of person for the job.
Heck yeah, I want him in there with me.
Yeah, but also just to sort of piggyback on what you were saying, John. It might not be true, but I think that's also a situation where you like you said, it's situational, whether you talk to the patient about more emotional trauma and why they might be acting a certain way, possibly because like some people don't want to talk about it, and they might not be more receptive to your care after that conversation. So it's sort of a balancing act, I would guess.
Oh, absolutely. Yeah, there's definitely, it's not definitely a thing that's like, oh, this person's been, trying to, punch at staff and security all day. Like, I can go see if I can have a heart to heart with them.
Right.
You got to read the room, man. It's like, it's like, you can't be trying to be like, hey, is there a way I can help you while bobbing and weaving and trying not to get hit? Workplace violence is a big thing in healthcare, particularly in acute care environments like the hospital, for sure.
Really?
Plenty of, in Texas, according to the Texas Workforce Commission, like there's like, on average across all industries, as far as I'm aware, last I heard, it's about like a 2% chance of any person in any field, just averaged all across different places, of someone encountering a workplace violence, of having a workplace violence encounter. So that can mean like, a client doing something to a worker doing something to another worker, what have you. And so in healthcare, it's at least 5 times that, unfortunately. It's on average in healthcare industry, workplace violence, you're at least like 10, 11 or so % likely to be a healthcare professional that comes into contact with some kind of workplace violence situation. So that can be, and that can be, verbal, abuse, like threatening. I've heard people say like, well, you know what, I'm just going to have someone, bring me my gun and I'll, shoot you with it. And, there's the thing where it's like, are they serious? And no, don't really have the time to figure that out. I'm calling security,
Yeah.
And so, or people, I've had some, like, quite a few people try to hit me or throw something at me. I've only really had, one, I can't find any wood to knock on around here, but I've only had one person so far successfully land like a good punch on me.
I'll knock on wood for you, man.
We got you, brother.
Thank you. Yeah. So, I'm like, okay, well, that wasn't smart on their part, because like now they've got a felony,
Yeah.
There's like all sorts of stuff. It's a felony to assault. Now in Texas, it wasn't a felony to assault any emergency room staff. Now in Texas, it is a state felony to assault any hospital staff whatsoever.
Wow. I didn't know
physically
that.
assault. Yeah. So,
yeah, of course.
Yeah. That's the thing where it's like, and there's sometimes you can enforce that. Sometimes you can't. Like if someone is, after, when they have dementia or like a traumatic brain injury or something, and they're not really in control of what their impulses are and what they're doing.
Right.
No one in healthcare is going to want to try to go after that. And the ones that do, any kind of, district attorney is going to be like, I'm not going to pursue that. There's no point, and so it's just, is situation by situation with that. But like, if you're in your right mind, or if it's, due in some cases due to a substance you took in or something, like if you're drunk and you're swinging at people like, this one person was, then, that's still within your control. That's your fault. That's a whole other deal. But so basically to go back to your original question, as far as like, when to, about the balancing act, when to have a heart to heart, and when to, just not be there. I like what Mr. Miyagi said in the second Karate Kid when he's like, "Hey, Mr. Miyagi, what's the best way to avoid a punch?" He said, "Not be there." I'm like,
Yeah.
if someone's throwing stuff in a room, leave. Like, that's one of the best things you can do. Even if they're not doing stuff like that, there's some people, like, you're not in a place to have a heart to heart, or they're not primarily your patient. You're just in there to help for a second, or you haven't built a rapport with them. It's really, you really want to be the best steward you can be of the time that you're there with them, whether that's your first and only 5-minute encounter of the day, or you've been dealing with them for weeks over multiple shifts.
My man quoted straight the Karate Kid. That's awesome. Oh, dude, you know what I just thought of too while you were mentioning this? Like, I didn't even think about this. You know what you have to deal with as well, I assume? Hey, man, there's straight criminals like that are on their way to jail, but like they got banged up, so you guys have to go stitch them up. So what? Like, have you literally like dudes that are handcuffed, and like as soon as they're ready to leave the hospital, they go to jail, right? Something like that?
Absolutely. Yeah. Wow. I mean, the people that are, even if they're under arrest for, suspicion of, what have you, whatever it is, it doesn't matter if they're the FBI's most wanted, or, they just stole something from a store or tried to, or whatever, and they try to fight cops. Like, it doesn't matter. They should be taken care of health-wise too. Wow. So, there's people that, multiple different kinds of situations where it's like, oh yeah, they were, drunk in public, and we're just doing a medical check, making sure that there's nothing going on, or like, due to any kind of pain or whatever, and make sure that there's not something deeper, that we need to fix emergently, or, sometimes it's just med clearance, be like, hey, like, they were a little off, so we don't know if this is their, baseline behavior, or if this is because they've taken in a drug, or like what's going on. So we need to make sure they're going to be okay, so they don't, more or less like kick over at, the jail or wherever they're going. There's also people that have been in a correctional facility for a while, and they'll come to us for healthcare as well. We call them, patients in custody, or custody patients. There are certain rules, regulations, like you have to have so many guards with them, depending on what the situation is, at least 2, one armed, one unarmed, all sorts of different things. And yeah, they need healthcare too. Just like, it's not like, oh, well, you did something to get in here. It's like, first off, you don't know their story. It's like, well, what are they here for? Well, you can't ask them, because that's actually a violation of their rights, and you can be sued for that. So there's a whole other deal. But really, the thing, it's like, you're not really here to find out like what they're being, condemned or judged for. Hey, whether they're a prison, custody patient or not, that's not what you're there for. You're there to take care of them and whatever medical needs they might have.
And I've seen it where it's where they do something in hospital that lands them in jail, and it's the same thing. It's like you treat them first, and the hospital staff has nothing to do with like the legal, what's going to happen to them after they get treated. But the police get involved, and they handle the legal side of it, but hospitals handle the healthcare. And I've seen them work very well together in the videos I've seen. So
I gotta say, it sounds like, because my pops was a LPN and then he was an RN, but it sounds like to be in this profession, you need to have a passion for it, a passion for money, because I know y'all do all right, and you can work wherever, but I think more of like an actual passion for it. And it probably is the kind of job, like, you must see like the rookies come in right from school, and you're like, just wait till you see the stuff that I've seen. But I have to ask, because this is, who knows what our channel is these days, but we do like to focus on some mental health stuff that can help some people out. So when you're dealing with this, and your hours, and the people that might be in jail, or people that are struggling, and all this negative weight and stuff that might be weighing down on you, could you share with us like something that you do, or some kind of mental health practice that you're doing these days? Or are you at all? Because you should be journaling, my friend.
I've done a number of things. I've tried a number of things. Sometimes it's just kind of a variety pattern sort of thing that you go with. It just depends. For me, being able to have someone I can talk to about some of it. I can, my wife is very gracious, and she will allow me to vent about certain things, a frustration about work, something that I saw that, it's like this should have gone this way, but it went this way, or we want this outcome, but we got this outcome. And, she's really, she's my safe space for that, by and large. The only reason I say by and large and not completely is because there's certain medical things. She's not a medical person, and she doesn't really deal very well with certain details, more so what some might consider, gory details, or, start talking about, certain fluids or insides and such. And she's like, no, none of that. I don't want to hear about that.
Yeah.
And it's not anything about like, oh, I don't want to be there for you. It's just like her body will have a bad reaction if I tell her some of the details and stuff. So, so there's some people I get to talk. Sometimes at work, you get to, talk shop and stuff, and you get to kind of work through some of that, and you kind of help. As long as you're in a good environment, which I feel like I'm in, I'm very grateful to be so. You can kind of, you can lift each other up in that sort of way, but and then also there's other resources like our at least our workplace gives us a certain number of free visits per year to what they call the employee assistance program, where they have therapists, psychologists that will, talk to you. You have a certain number of free sessions per year and be like, hey, look, like do this. Plus they have also, my facility is also very good about making sure that there's other things that they're doing, other measures they're taking where, healthcare workers can be replenished. So as far as like what I usually do, like I like to have someone to talk to. If it has to, be something gory, super detailed, I either go to that assistance program, or I can, like talk to my mom. My mom doesn't mind talking about gory stuff, and I like to, trust her with a lot of that. And she's, very helpful to kind of be a sounding board off in that regard. Talking shop with others, and man, there's just other things like sometimes like if there was like a lot at work, I remember the first patient death I had at work. And after that, and I was still, my wife was then my girlfriend still. And I remember talking to her on the phone. We were planning on going to the theater that night. And I was like, yeah, so just checking on you. I'm still up for going, but just so you know, if I kind of weird or something, this just happened. And she was like, oh, like, do we need to cancel? Like, do we need to do something? What do we need to do? I'm like, you know what? Actually, I think it'd be really helpful for me to still go see that movie, if that's cool and everything, and then still just have a good time. And, so sometimes it can kind of be helpful to, you don't want to like indefinitely suppress, issues that you have or feelings or, just different things like that. But sometimes there is a healthy level of being able to suppress things a little bit, just until you're better able to deal with them, until like the initial sting of, or the pressure of whatever it was, just, it kind of wears down a little bit, and you get a little further away from it, and you can see, a little bit closer, at least to 2020 hindsight with that sort of thing. So I mean, in that regard, going to see a movie, we like to watch a lot of TV and stuff at home. I play games once in a while too. It just kind of depends. But in any case, like whatever that looks like, people being part of your support system, whether it has to do with addiction or just dealing with life or whatever kind of work that you're in, that support system, at least as far as I'm concerned, is key.
Yeah. No, that makes total sense. And I like the having a bit of normalcy still in your life. Like you continue, because things are gonna happen. You can't predict them, and you can't make your schedule fit in with that all the time. And I like that, and I think I saw it on a video, but it's like you don't have to deal with the situation right then and there. You can wait until it's less severe. You can wait until things calm down and then address it. And it's usually better to do it in those particular instances.
I also like the fact that you have, like you mentioned, you can talk to your coworkers, because who would know what you're going through better than them? I think police or, a lot of first responders have that too. Like That's why a lot of police officers are friends with other police officers, because they've seen the same kind of stuff, just like you. And you know what I was just thinking about is that, bro, you go to work at a trauma center, so that holds a lot of weight as it is, man. Like, you're getting faced with that. So, like Dane just said, I'm glad you can, like you mentioned, you went out to that movie, because I think that's probably what you have to do. I mean, whatever's right for you, right? We always say that on the channel. When it comes to mental health, whatever's right for you is right for you. Some people would want to just be away and be quiet with that, because that's such a heavy thing to deal with. But the fact that you could be like, hey, let's kind of like, let's get some normalcy, like Dane said. Let's go see a movie, or you mentioned let's do some games, something to, get away from that. That's huge, man. That shows some mental toughness for you too, that you can kind of like be able to sometimes leave it there and be able to kind of do your own thing. I think that's huge, man, for sure.
Yeah. On the flip side of that, you still, you still want to feel stuff. I mean, there's an aspect where, some people might be shocked to hear this or learn this, or they might just think like, oh, that can't be true. But honestly, especially in that kind of environment where you see people with all sorts of issues, and then also some people, pass on in that kind of work, it just hear me out on this. It gets easier for us to deal with, like, as far as healthcare workers go. There's an aspect where, we're never going to, or no one in healthcare should say that, like, oh yeah, it's just, that's just easy, not by any means. But after a while, it's like, you did all you could, and you're able to make peace with that. The more you kind of encounter that kind of situation, the more it's not that you navigate it emotionally differently. It's just, you see where the path is worn, and you're kind of able to fast track that a little better. And, there are still cases where there always is going to be something that gets to me a little bit. There have been cases where there's even been a couple times ever when, and I'm not ashamed to admit it, like, there's where I've seen like a situation between, like family members saying goodbye to their loved ones, and like one or two times ever where I was like, excuse me, I'll be right back. And I actually went into the bathroom and cried. Like, I mean, like there's stuff when, like, and some people are like, oh, well, you can't do that, or you got to shove it down or whatever. It's like, well, every person is going to be different in that regard, but also it's kind of a blessing as well to still have it affect me a little bit here and there. And to be like clues like, hey, here's a clue that, you're still human, that you still feel and everything. There's a lot of aspects to empathy when you see so many cases where it's primarily going to serve you well as cognitive empathy, and not empathy where you feel every person. Because if you use empathy and try to feel every person's situation, you're going to burn out. You will not make it there.
100%.
But knowing that empathy, like in a cognitive sense, and using that to better help people again, physically, emotionally, spiritually, what have you, is a huge deal. I'll say it's good to know that those kind of situations can affect you still, and be like, hey, that's I'm not machine just yet. I am human, and that's something that you want to not like shove down, but that you want to embrace.
I think everyone in those situations has to have a bit of that worry sometimes, where it's like, am I numb to this, and has it changed me? Because you're even mentioning like the gore aspect, like the bodily fluids and stuff that you're exposed to like regularly. You develop like more, I think, maturity to it, and more professionalism, where it is something that doesn't affect you as much as it used to. But then, like you said, occasionally, like, everything kind of builds up and it gets to you, like, shows you still care. And yeah, I feel like everyone in these kinds of fields has to worry about that to some point. But our brains are are wired to respond heavily to new experiences, and the more we get exposed to the same experience, it's not like it's not a big deal, but it's not as visceral and it's not as huge to us as the first time it happened. And then, like you said, occasionally, like there will be someone you really bonded with, and that's a bigger deal than, maybe some of the other stuff, because it was someone that you invested in and, sort of had an attachment with. And so I totally get that. I think everyone can understand that for sure.
Hey man, I'm just glad you came on here and you're sharing this kind of stuff with us, because Dane and I've talked about it for 15 episodes now. It's weird, man. Sometimes talking about like your feelings and stuff, it's like, especially us being dudes, it's thought about as yo, what are you gonna be all emo about it? But man, I just wish more people just open themselves up to be like, hey, yo, we ain't perfect, dude. We're some broken people, and unless you work on yourself, then things aren't going to go too well. So I'm glad to hear that you're doing stuff to make yourself right, whether it be counseling and I'm glad you have a support system with your wife too. I mean, I feel like having a partner in crime, like, Dane's girl's like a ride or die too. Like whatever, I'm sure whatever Dane comes home with, and he's got 17 different jobs, so he's able to have that support system. I have a Pomeranian. I'm currently swiping on Hinge, girls. Did I mention I don't have my latest thing? I said, I got no diseases, no kids. I love Jesus. I hope you do too. But I think let's leave it on a positive thing. So do you have any etiquette tips this is probably a weird question, but for ER, like for Johnny, we talked about etiquette at the studio. Kenny, some etiquette with Airbnbs. I would love to know, what kind of stuff should we not be doing? Listen, I get it. Emergencies are emergencies, but there's also sometimes the people that probably can wait. What could you give us for etiquette tips, tricks for being in an ER? I don't know. Is that a weird question, Dane? Do you co-sign this question?
No, I think it's great, because I've seen videos like this. So.
All right. So yeah, so let's turn this into a reel. Adam, could you give us some ER etiquette tips and tricks for if unfortunately you have to go there?
So the process that every ER can be different. So do know that I'm going to be speaking largely from how ours works. Okay. So basically, one thing is like, we just, we need to know like what symptoms you're here for. And we need to know like briefly, like what your medical history is and everything. Like we want to be thorough. We also, might not need to know that, well, I was taking care of my cat and boy, it was fussy. And, it's like, that's like, it's like, I want to hear everything you're saying, but also we kind of need to get down to what you're here for, And here's another thing as well. Like there could be some stuff where please don't be afraid to advocate for yourself. I'll say this, if you're there in the emergency center, emergency room, emergency shack, whatever, you're there because you need someone else's expertise. Mm-hmm. Okay. So, do know that whenever you come in there and you say, okay, this is this, and this is what's needed. Maybe you're familiar with that situation, or maybe you just think you are, or, maybe you did a prior consult with, Dr. Google beforehand. You think it's this. Why do you, the good question, a good thing to be would not be to say like, nah, get off of Google. That's not what you have. It would be like, it's interesting to bring that up. Why do you think that would be the case? And like have a real discussion with them about it. Because sometimes like there's some kind of intuition, or at least part of their reasoning for thinking it's a certain something, whether it's that something or not, could be instrumental in, realizing what they actually could have. So what I'm saying is, don't be afraid to advocate for yourself. It's pretty much run by humans. And so there's stuff that's going to be missed. And so if there is, don't be like, oh, well, I guess it wasn't important or whatever.
Oh, yeah.
Like, no, just please, if there's something that, we're missing or that you think we're missing, just participate amply in your care and make sure that you're getting what what you're needed, you're considered part of your healthcare team, or at least you should. And so always make sure that that's the case. But just know that there are different levels of care. So if you have flu-like symptoms and you feel miserable and you think, oh, this is what I should go to the emergency room for. Now, if you're like 70 years old, have COPD, and you're asthmatic, that could be a thing you need to go to the emergency room for. Or if there's like, okay, but there's this stuff in my chest, it could be congestion, but it feels like kind of uncertain or whatever. That could be something you have to go to the emergency room for. And there are times when you're like, you know what? That seems like a dis-ease, but not an emergency. Maybe we take this to urgent care. Take that with a grain of salt and just know that there are differences in level of care that are needed, because, your decision, any kind of medical decision, like as far as like, where should I go for my care? I'm not going to be able to tell you that. Nurse is in their official capacity is not going to be able to tell you that. You have to make that decision for yourself. It's like, what kind of level of care do I need? Now, if you come in and we screen you in the emergency center and they're like, okay, well, a provider can make the call, be like, okay, well, this is not considered necessarily an emergent thing. So what we're going to do, we'll send you with a shuttle to our urgent care, and they will take care of you over there, which a lot of times urgent care is going to be less of a wait anyway. Or sometimes you have to call 911 because you have a family member that needs help, and maybe due to, size or what have you, weight, you can't move them and they can't get themselves up. All sorts of different reasons. Maybe you need to call an ambulance for that, and they need to, help with that aspect. There are, exceptions to each of these kind of things. Do what's best for you. Know that there's other options, and make sure you advocate for your own care. And other than that, just, even if you're having a hard time, and we want to be there with you wherever you're at. If you're having a tough time, we want to be able to walk you through that tough time step by step. We understand people are going to be a bit frazzled. People are going to could be at one of the most vulnerable points in their life when they're there, whether it's due to falling from something and your foot is feeling weird or not pointing the right way or what have you. Or, you're just in a massive car wreck, or, a crazy situation might have, like you've been shot, and like, okay, understand that by and large, at least as, situations I've worked in, like we're doing everything we can to help you in the best way that we can, according to acuity and, that sort of thing. I think the last thing I'd probably say is that if you have to wait in the waiting room before you're able to get a room, know that it's because we only have so many resources, man. And so what we tell people, they're like, oh, what's the wait like? Well, first off, we can't tell people the wait before they've checked in, like what wait times are looking like, because it's actually against state law as far as I'm aware, because you don't want to deter someone from getting the type of care that they need. So if they have something that's actually pretty bad, and they're like, oh, it's a long wait, I'll just come tomorrow. And then there might not be a tomorrow in some cases. They don't want that to happen. So, that's, and granted, that's the exception, not the rule, but, you don't put everything together for the rule. You're there to catch the exceptions, So, just do realize that, like, if there is a wait there, and wait times can vary depending on the day, the kind of situation, what time of year it is. You can be taken directly back to a room and be out in about an hour or so. Or we've had some patients that have had to wait for crazy times. And I'm not saying this makes it easy, but sometimes for over 24 hours and solely in the lobby. Now that's a crazy situation, but it has happened, 24 hours in the lobby before they're able to get a room. And that's not good. Understand that if that's the case, it's not because, well, we're just going to forget about this person or we don't care about them. What we tell people is that if you are in urgent or emergent need of like some kind of intervention, if you're an unstable patient, there is no wait time for you. If you're unstable, you're not going to have a wait, at least as far as we're concerned. If you're waiting out there, it's because, a medical provider, nurse prac, doctor, what have you, has determined that, you're not going to die out in the waiting room. So now pain is a real thing, and you can be in pain And I've had people tell me, it's like, no, I need a room because I'm in pain. I'm like, I don't doubt that you are. That's not the issue. Is that, and the pain is no small thing. And we try to do what we can to mitigate pain, prop something up, even sometimes get them some meds. But what you got to understand is that pain is not the determinant of whether we get people back there. Else there's going to be way too many people back there where there's not even enough rooms. It's whether they're stable vitals wise or not. If it's like they can get to a place very quickly where they get in a situation that is not conducive to continuing to live life, then we're going to have you back here is the idea. Like, and you're not going to wait. So do know, like, if there is a wait time, it's not because it's like, well, we also have heard people say like, oh, well, I know I came before that person and they went back before I did. Like, well, and what I want to say is like, we'll be grateful that you don't have as bad of an issue as they do, because that's why they got in before you did, because they got a worse problem than you do. Try to be understanding with it. We will work with you as much as we can, and we'll get you back as soon as we get a place for you. I try not to ask for a whole lot in that regard, because there's people in all sorts of situations. Just try to have a little bit of grace for us with that. Of
course. Well, yeah, you have to triage the patient and everything. That's every emergency needs to be taken care of before the ones that can wait. And yeah, like I think probably people in pain are definitely the ones that they can understand that, but at the time it's hard to be understanding when you're in pain. But yeah, that's the reason behind it. I also like what you're saying about going to like an urgent care, but I also think that there might be like an overall sort of perception that people might have where it's like you have primary care, you have urgent care, and you have emergency care, and sort of thinking like one's better than the other. But there's a bunch of situations where primary care is actually going to be the better path for you if it's like a chronic ailment or something like that, or if it's something that's not an immediate emergency, because a lot of times emergency rooms, they'll say, okay, we've gotten you to a stable point, we've determined nothing's immediately wrong with you, but now go to your primary care doctor because something could be happening that's causing this. And it's a more long-term approach to your health, which is important. So it's not like either one of those are better than the other. It's like, which one are you going for that is serving your health properly?
Yeah, if you're like in a diabetic emergency, that's when one is better than the other. Your sugar's above like 500 for some reason or something, then it is better to go to the emergency room. So, like you say, it's all situational. If you're thinking, I wonder if I have diabetes or if there's something that having to do with like chronic fatigue and stuff like that, there is a best option. And that best option is usually going to see your primary care provider, So, I mean, it really depends on it. It's just finding the right tool for the job really is all that is. You don't want to go to your PCP's office, be like, yeah, I know I didn't call for an appointment or anything, but I was wondering if the doc can see me because you see these two bullet holes right here? They're going to be like, no, don't. We're calling an ambulance. Stay right there. We'll get some guys. Don't move. I mean, it's just, it's just a tool for the job. You also don't want to use the sledgehammer to, put in a dainty little screw,
Well, let me tell you something, guys. See, this is the problem we have experts on, because listen, this is going to be a one video. I can't do 8 hours because I'm like fully invested, but this is perfect. This is what I want to do, because I want to talk about like, egos, like the doctors, like Navy SEALs. I want to talk about a bunch of stuff. I got all kinds of stuff to talk to you, but guess what? This is where we're going to wrap it up, because Dane, is there anything else?
No, well, dude, I love chemistry. I love biology. I love medical stuff. I watch a channel with cadavers and all kinds of stuff. So I knew this was going to be a long video.
Oh yeah. So Dane, but was there anything else?
There's nothing else, man. Are we gonna do 2 videos out of this?
No, I'm
No?
not saying for 8 hours. This is gonna be probably an hour 45 minutes when I'm done editing it. But Adam, listen here. Let's all do a quick wrap up because listen, and I don't mean that. Listen, I love both of you. Well, especially Dane, Adam. I think you're amazing, and for real, I want to thank you for taking the time. But there's just so much to unravel, dude. Like literally, I could go into the waiting room thing. Like, I had like a bunch of questions, but at the end of the day, I think this is a good. You're just a phone call away. So if you ever want to hang out with us again, and we come at, and but to summarize, listen, I think what you said and what you brought could actually really help a lot of people out with whether it's giving them a perspective on the stuff you have to deal with, or if, as a patient on A, how to act, and B, what to expect. And I think it was really freaking cool, man. So I appreciate you, brother.
Of course, man.
Yeah.
If I be like, okay, like what's someone's like main takeaway or something is that, look, whether it's something medical, something psychological, you're thinking about hurting yourself or hurting someone else, or whether you've already done so, or, whether you've, you just need someone to talk to, like there is some kind of resource out there for you, whether it's where I'm working at, people are like, oh, I'll see you at your workplace. I'm like, I really hope for your sake you don't. But if you need it, great, but like, you don't want to have to be there, No. But yeah, just know that, whether it's that or you're dealing with an addiction or something like that, dude, like reach out to someone for help. Like if you don't know what to do and you're like, I feel like I'm in some sort of crisis, call a crisis line or come in the emergency room. Like we deal with all sorts of, people in crises and that sort of thing. And, it's like, or like you're trying to get off of a med, like whether or not you have an emergency situation, we can at least point you to a resource or resources that can, help you. You do not have to be alone with that. Please find someone that can help you with that.
Yeah.
Amen. What about you, Dane? How would you summarize your time here with our expert, Adam?
I feel like that's perfect. What Adam said, I feel like it's perfect.
Yeah, you nailed it, bro. And you like delivered some pretty cool info today, man. I genuinely appreciate it. And Adam, was there anything else?
5 hours later.
Well, I
think this is a good warm.
That's what anyone's left in. I think that's it. I think
we put our toe. I put my toe in the water and in the sand. How's that song go? I don't know.
Cold beer in my hand.
Cold beer in my hand. That's the way it was. How's it go?
Life is good today.
Life was good today. Well, ladies and gentlemen, this wraps and concludes. This brings our lovely meeting with Adam Walton to an end. I want to remind all of you to make sure you hit that like button, show support for Adam, show support for me. And if you want to throw Dane some support, please throw my man some support too. We thank you so much for listening on this historic episode number 15 with patient care technician Adam Walton. Thank you so much for listening. And don't forget, this is Download the Uplift, a place where when we fall, we try and uplift you. Thank you so much, boys. We appreciate you guys.
See you later. Thanks for the support.
Sure thing. Take care, y'all.